Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello, everyone. I'm Dr. Rajat Jain, Associate Professor, ENT Department, King George Medical University. So today we'll be having a small public awareness about various myths of vertigo. So there are a lot of various myths of vertigo which people think of, and people are not able to understand what vertigo actually is, and they are not able to realize that vertigo is just a symptom. So, to begin with, first thing, I'll have my talk both in Hindi and English. So, what is vertigo? Vertigo means चक्कर. अगर किसी को चक्कर आ गया है तो वो बहुत ही सीरियस प्रॉब्लम है और उसके लिए तुरंत हॉस्पिटलाइजेशन चाहिए. No, it is not like that. Vertigo can happen because of any of the multiple problems. It can be because of inner ear problems. It can be because of some kind of sugar disbalance. It can be because of some kind of BP problems. So you just need to make a diagnosis first, and most cases they don't need hospitalization. Is vertigo related to only neurological problems? The answer is no. 80% times vertigo is because of inner ear problems, which is called peripheral vertigo. 20% times, yes, you can have a central vertigo, the cause of which lies in the CNS or brain. In case of vertigo, you should visit a ENT surgeon, and it is easily treatable. What are various other problems which you can have with vertigo, and what are various myths about it? A lot of people think if there is vertigo, then they have a brain tumor. No, it is not like that. Yes, you can go for a screening CT scan of your brain to rule out any kind of a pathology, but most of the cases, vertigo is not associated with brain tumor. Brain tumor is very rare entity. And yes, in brain tumor also, you can have a part of vertigo. A lot of people say, when I go to heights, I have vertigo. No, that is not vertigo. That is your fear with heights. That is called altophobia, and actually feel a bit dizziness when you go up. And that is your inner conscious behavior. It is not true vertigo. What are various conditions where you can actually have vertigo? Various conditions of ear are BPPV, Meniere's, vestibular migraine. These are various problems which are associated with vertigo. And now you have proper vertigo specialist available with whom you can contact and you can get treated your vertigo. Okay, now another question frequently asked in cases of vertigo is it associated with headache? Yes, your vertigo can be associated with headache. That is another entity in which vestibular migraine comes into play. This is a variety of a migraine which is associated with vertigo. So vertigo is a condition in which there's a lot of spinning of your head and you feel dizzy, and sometimes there is vomiting also. So a lot of people say चक्कर भी आ रहा है, vomiting भी हो रही है, disbalance भी हो रहा है, बहुत बड़ी problem हो गई है. It is not like this. If the vertigo is there, the emetic center is stimulated, and because of that, there is vomiting. So this is the problem which is associated with vertigo. These are different conditions in which vertigo is there. So my point is, whenever there is vertigo, do not fear. Go to a specialist, evaluate. You should evaluate what is the cause of your vertigo. And once you know what is the cause of vertigo, treat it properly. That will help you out. Nothing to worry that if you have a vertigo, it cannot be treated. Mostly all the patients are treated well, and it might be a possibility that you can have a long treatment. So thank you very much. Stay healthy, stay wise, treat your vertigo well. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.